Tomorrow is Sunday, and I will not have any um, stuff at work, so hey, I'm preparing to go with food. I'm boiling some eggs and all that. How are you guys doing? Yeah, nursing and NP job. Nursing or NP? Nursing or NP? Which one do you like and why? Nursing or NP? Which one do you prefer doing? We can see nurse or NP. Nursing or NP? Nursing or NP? Which one do you prefer? Let's talk about it. I did a video on Facebook yesterday, and I was talking about being informed before you go to school to do your NP program. At the bedside, a lot of people are working as NPs, NPs working as nurses and all. Why? It's really a choice. What is your focus? What is your mission? What do you want to attain? I talk about the fact that I personally, I like acute care. I don't like outpatient because I am what? Solution focused. It's so fulfilling to see people come in psychotic, in crisis, hearing voices. Hello, hi Bella. And then they get them on, even some have catatonia, they get them on the benzo, they get them on ECT, and then 2 weeks go by, 3 weeks go by, 4 weeks go by, and then they start getting better. I am doing well. How about you? How about you? I'm doing wonderful. And then bit by bit, you see these people get better. My day is going well, Lee. My day is going well. My day actually ended. It is 8:54 p.m. in the evening, so my day is over. I just got home. I finished eating dinner. I'm getting stuff ready for tomorrow on the fire. So I said, let me have a little chit chat between working at the bedside and between working in an outpatient as a NP. What do you prefer? Why? It depends. Thank you. To me, it depends on your goal and what makes you feel fulfilled in your career or profession. At the point where I am in my life, mullah, money is the most important thing for me. Between preparing to send kids to college and retirement, I need every dime. I need every penny I can get. Aside the penny, I need to feel confident. I need to get up every day and look forward to going to work. And that's how I feel with, oh yeah, I need to see my dollar bill. Because you know what? Uncle Sam wants his share and I want to have it too. So I need the dollar bill to be where it needs to be, right? Aside that, I want to feel fulfilled. I want a job that when I'm going in, I'm looking forward to it. My co-workers, I close from work and On our way back, we'll be, are you Christian? I don't know. On my way back, like we'll be gisting. Sometimes we will stand outside and talk. Oh my God. My friends are Nigerians. It depends on where I'm working. My friends are either Nigerians or Cameroonians. Right now, at the place I work, I love my colleagues that, of course, those I'm close with. And you close from work and you stand and you just talk about everything from career, from like everything, life, wanting to dive into business, everything, right? All right, if you are Christian, it's a good thing. If you are not too, it really doesn't matter. It's your choice. I'm not God, so I'm not here to judge you or judge me. Okay. Being a Christian don't make you perfect, and being a pagan don't make you perfect. It's life. Trust me, it's life. There are a lot of people in the correction system that are convicted of things they've not done. They are not criminals, but they are convicted because of one reason or the other. Because of injustice, parental alienation. When my book finally come out, you see parental alienation and it's associated, like you can go to jail without necessarily being a criminal. My journey as a victim of and a survivor of parental alienation tells me so. You won't believe it. As a parent, you have another parent that don't like you and connive with the child to lie about you so you get persecuted or something for something you've not done, and you can end up having a record not because you're a criminal. So I have learned to not judge people, and I've seen, you don't want to know, I'm not going to tell you that Christians are the most saints in the world or they're the most perfect people in the world. No. So I'm not really, it doesn't really matter if you're a Christian or not. What matters is how you treat other people, how you perceive other people, how you respond to other people's needs. When people, your friends, your family, your whoever is in crisis, how do you support them? How do you, you know, um, associate? How do you see? I'm an open-minded person, so I'm not going to judge people based on things that happens in their lives. What I would not tolerate is you not working towards improving. You get it? If you are going through anxiety, you have to think about what is creating the anxiety in you. There is no amount of medication. I will prescribe medication for you, but there's no amount of medication that will solve the anxiety issue. It is your coping and you identifying what is really causing the anxiety, your triggers, and how to eradicate. If it's money that is creating the anxiety because you are scared of not being able to pay your bills, how would you take care of your kids? How would you provide for them? I'll be honest with you. You can take medication to mask, to keep masking the symptom, how your body is responding to the stressor. You will take it and take it and take it until you solve the problem that is creating the anxiety. There will be no resolution. You get it? So I am an open-minded person, and I'm not going to be there, watch you go through this and judge you for it. I'm going to try and process stressor with you to try and help you to identify that this is the problem. Okay, how do you solve the problem? You get it? So what I won't take is your failure to address the problem, to identify, to try and work, brainstorm, get a therapist or a coach or someone to help you to process the stressor, relabel the stressor, and find solution to it. Because I don't want to be stressed with your stressor. That's one thing I cannot take. I want to help you to overcome your stressor. You get it? But I cannot adapt your stressor. You get it? I cannot adapt your stressor. But other than that, I won't judge you because you couldn't pay your bills. I would not judge you because you couldn't pay your bills. I will help you to find resources to help you pay your bills, which includes maybe acquiring a skill, work, finding a job, going back to work, that kind of thing. However, after I finish helping you navigate, try to show you links, how to get resources, how to get support, how to pay the bill, and you still don't do the work you need to do to get the bill paid, so your anxiety will be over. I can't take that. It's like having a patient that come to you. You see how I scratch my head now? Then you have a patient come to you, and trust me, these are real. This is real. Like, this happens. And someone will come to you and tell you, oh, I just scratched my head. What do you think? You think it's going to crack open? Really? Yes, that's what I'm talking. Those I can take. I don't like behavioral health. I like people who are going through true situation and need help. Oh boy. Every day that's a so feel. So feel. You see what I'm saying? Yeah, tomorrow is Sunday, so I am trying to prepare for tomorrow. I don't want to go to work and not have food. So I'm preparing some. So I have my egg, I have my yogurt, I have my fruits, I have my oatmeal, I have my bagel, that kind of thing. So I'm trying to get ready for tomorrow. So you see that? You meet somebody on the street. How do you relate with them? You just meet people, you are prejudiced towards them, you are judgmental towards them, but still you say you are Christian. And that's what I've seen from humanity. So really, religion, I don't practice religion, I practice spirituality. I am a spiritual person. I am a spiritual being. So my connection with God, the way I serve God through my relationship with people is what matters to me. You understand? My main job is so nice. I go and I leave home every day, look forward to working. And then I have another job, I leave home every day wondering, do I really want to go? That kind of thing. So, and it all boils down to human relations. You get it? So personally, I don't judge people based on their religion, or trust me. You see that thing they said, lesbians and non-lesbians, but my history in working and encountering stats, they are some beautiful spirited people, very nice people, very nice people. But in reality, Christians will judge them. But I've also worked with Christians who are so mean. Mean. So, no. Being a Christian don't really matter. It's how you relate to people that matters. Anyway. So I'm back to the story. See, I go to work. I prefer acute care from get-go. I prefer acute care. Because I want to see that what you came in with, there's improvement. There is so much improvement. And I've seen that constantly, whereby you have someone coming, flying guess words left, right, east, south, like throwing tantrums, beating people up, cracking doors up. I give you 2 weeks. After, it's mental health and nutrition, they go hand in hand. After they are in an environment where there is constant 3 meal around the clock, they are encouraged to take a bath. They are encouraged to eat. They are encouraged to be compliant to their medication. I give you 2 weeks. When that medication, the serum level of the medication start going up, they are now taking baths. They are now around. We know we are social beings. That's being socializing. and good nutrition. All that comes together to help your mental health, make it solid. Yep, all that comes together to make your mental health solid. You get it? Yep. And so I enjoy that as a situation where you see people come in, you go through all this. And I love the doctors I work with, because if they see that you are not stable enough and you want to go, they will petition you to stay. They will find the criteria of, how to petition and get you to the judge to approve your stay against your will, to make you involuntary, so that you can get better. And I've always admired the beauty of their approach, because I've seen how they treat these patients, right? We go from not having all these crisis patients to improving, becoming sweet, having normal conversations, identify morning, afternoon, evening, knowing their names again, knowing where they are again, like constant reorientation and all that happens. And all of a sudden, a patient, like recently, we have to downgrade a patient from severe cognitive impairment to mild cognitive impairment. That is what nutrition and serum, the right serum blood level of your meds can cause. If you're not taking your meds, your serum concentrations are low, poor nutrition, plus maybe you are drinking, plus maybe you're still using substances. My dear, I don't know where you want to get with that, but what I've seen is once they come to acute care, at least where I work, we don't rush them to go. We take our time, we certify them, we provide them the right care, and bit by bit you see them improve. You see them improve compared to other instances, or working outpatient in the community. The patient is sick, they come, you look at them, you check them, you give them meds, they go back. You don't know whether they are taking the meds or not. But as inpatient, they are taking it, you are there, you are watching them, you are helping them, you are doing your morning rounds. Bit by bit, with time, they start improving. One patient that I've seen that we discharged, that is really so good and left from the situation they are, and they are going back home to their family. That's the best. Like, I always remember that woman. So you see, that's why some of us are doing what we do. I feel more fulfilled in that situation, being in acute care, seeing results. This is outpatient. My money comes first and my fulfillment comes second. Everything else, my children too comes. My children and my money are on the same level. They go hand in hand, because if I don't have the money, I can't take care of them. You get it? So I need to have the money, the moolah, the lasha. I need to have it. Yeah. So ask yourself, what do you want? What makes you feel fulfilled? What is the most important thing for you? Money or what? Me, it's two things: money and being able to feel fulfilled on the job. I need to feel fulfilled on the job. That and my money. So the choice is yours. The choice is yours. And also, do you like to bring work home? There are factors to look at. You want to bring work home? You want to keep work out of the home? It's a choice. And it's a big decision to make. So if you have to make any of these decisions, make sure you are having consultations. Like up here, consult. Pay for private services. Yeah, that's what I will say for now. Oh, have a good night. You have a good night. I'm going to bath. Talk to you guys later. Adios.